Good afternoon. Welcome and thank you so much for joining us today. We know that the COVID-19 pandemic has accelerated the adoption of digital health tools. We've seen an explosive growth in the number of people using telehealth, accessing personalized health data, contract tracing, and outbreak tracking. To foster the digital health momentum, building trust, using data to drive positive outcomes, and ensuring access for all populations is essential. I'm very pleased today to announce a new initiative of the World Economic Forum's platform for shaping the future of health and healthcare. Live longer, living better, using digital health to combat NCDs in aging populations. With partners from industry, civil society, academia, and government, there is the potential to revolutionize the care continuum for those living with NCDs, from prevention to follow-up treatment. The initiative will leverage technology, regulatory, and lessons learned from the pandemic to effectively and equitably combat NCDs in aging populations. Today, we have convened an amazing panel of experts who will share their perspectives on unlocking the power of digital health. We will hear insights on driving better health outcomes, including prevention and treatment, while safeguarding patient privacy in sharing patient data. And as a reminder, if you are sharing through your social channels, please use the hashtag WEF22. But before we get started with the panel, it is my extreme honor and the privilege that we all share to invite to join us the Honorable Minister Mandaviya, Minister of Health and Family Welfare from India, who has some opening comments for us. Minister, please join us at the podium. Thank you.
Thank you. Good afternoon, everybody. Digital health is a great equalizer and enabler to support universal health coverage and sustainable development goals, and can help ensure accessibility and affordability of health service delivery. With prime focus on moving from siloed to an ecosystem approach for digital health, India is creating a national framework for digital health in India. Under Ayushman Bharat, means Long Live India Digital Mission, we called ABDM. India has embarked on digital transformation of healthcare in India. The focus is on creation of longitudinal electronic health record for more than 1.3 billion people of India. We have already issued more than 220 million unique health ID along with health facilities and provider registry. India has already utilized digital health interventions for its national programs management. Reproductive and child healthcare IT platform tracks more than 120 million pregnant women for their ANC, PNC checkup, delivery planning, and over 90 million children for immunization. Health Management Information System regularly collects data regarding health programs from more than 200,000 health facilities. Through NCD applications, we have screened more than 80 million citizens for diabetes, hypertension, and cancers, in turn creating a population's profile of India. Telemedicine platforms eSanjeevani has benefited more than 390 million beneficiaries through video consultations during COVID-19 pandemic, making it the biggest such platform in the world. COVID platforms monitors name-based vaccination and has monitored administrations of more than 1.92 billion vaccinations doses, including beneficiary registration, AEFI monitoring, and a QR code-based digital vaccine certificate. India has promoted digital health agenda at global level as chair in Global Digital Health Partnership. It was India which had moved the digital health resolution in WHO to prioritize global framework for digital health. We have offered COVID as a digital public good to other countries to aid their vaccination efforts, aligned with India's commitment to the traditional philosophy of Vasudhaiva Kutumbakam, means world is one family. Digital health interventions can help penetrate health service delivery till the last mile, ensuring equitable healthcare service delivery. With technologies like artificial intelligence, cloud computing, 5G, nanotech, we need to create a tech-supported healthcare services delivery which is resilient, reliable, and accessible till the last mile. I look forward for an enriching discussion on digital health. Thank you. Thank you, everybody.
Thank you, Minister. Thank you, Minister. Very inspirational look forward, and we look forward to watching all of your progress in India. Thank you. So now let's start with the panel. I would love to ask each member of the panel to introduce themselves and tell us a little bit about why you are excited about this topic today. Minister, may I start with you?
Budi Sadikin, Ministry of Health in Indonesia. I'm interested because 17 months in health, nuclear physicist by training, 30 years in banking. So I would like to learn a lot about health.
Well, I think you have a lot to teach us as well, so we look forward to hearing from you. Yes.
Belén Garijo. I am the chair of the board and the CEO of Merck. I am also a medical doctor by training, specialized in internal medicine and clinical pharmacology. And I'm passionate about this because I am absolutely convinced that the combination of patient care provided by healthcare professionals and the integration of technology and data will definitely result in much better patient outcomes.
Thank you. Baroness.
I'm Joanna Shields. I'm the CEO of Benevolent AI. We are a clinical stage AI-enabled drug discovery company. I'm excited to be here today, even though I'm a little bit of an outlier on the panel with no background in science. But we set out to build our technology in the service of science, and in this case, drug discovery. And we've actually now reached the commercial stage. So it's exciting to see science and technology come together in such a bold way and actually produce high-quality results for patients.
Thank you.
Yeah, Bernd Montag, also theoretical physicist, proudly representing 66,000 Siemens Healthineers. For those of you who don't know who Siemens Healthineers is, yeah, so I sometimes say that we are the biggest startup in healthcare. Yeah, so we are the IPO'd former healthcare arm of Siemens, and we soon after combined forces with Varian, a leader in technology-based cancer care. And we have strong positions in medical imaging, in lab diagnostics, and in, let's say, technology-based cancer care, and in interventional techniques, and in digitalization and AI. And to some extent, what we discuss here is right at the core of what we are doing. Yeah? That's why I'm excited to be here.
Wonderful. Well, thank you. I know we have much to learn from all of you. And Minister Budi, let's start with you. I know that recently global health has been named a major priority, and that you really led the way with developing and utilizing contact tracing tools during the pandemic. Tell us a little about your vision for continuing the digital health momentum in your country.
So I learned the hard way. So not during classroom or somebody teaching me, but I learned from the patients. When I joined, the testing in Indonesia, PCR test is about 10,000 per day. WHO standard one every 1,000 population a week, so it's around 38,000. So it's very difficult to increase that. I realized because Indonesia is federalized, so all the lab is not directly reported to us. So we make a direct connection to the lab, and suddenly the numbers increase to 50,000 per day. So bypassing all the federal government and federal cities. The next thing that happens is also funny. We then integrate that PCR test into the check-in counters of the airlines. Because before you travel, you need to have the PCR test, right? So we online do the interface online, and then it increases again to 100,000 per day. But the best one is when we link that PCR test obligations to enter public spaces, especially the malls. Indonesians would like to go to the malls every weekend. So then we put a scan barcode, you have to scan. If your last PCR turns to be positive, you have a black, so you cannot enter the mall. So then it increased to 250,000. That is an example how in less than 12 months, with very simple technology, pushed by COVID, and suddenly we have a great testing and tracing tool. I give you an example that working with international companies. We just passed the 411 actually today vaccination to 200 million Indonesians in 17,000 islands in 16 months. So one of the reasons it's so successful is because suddenly I received a call from WhatsApp that would like to work with us. So we do a chatbot that people can register via WhatsApp to choose the vaccination places. And it's so successful, even the whale catcher, the CEO of WhatsApp, I just know this guy, had a video conference with me, and then he got the chance to speak at United Nations General Assembly because he had worked with us on vaccinations for hundreds of millions of Indonesian citizens. I still fail to do it with Google because I would like to geotagging every family house that has been vaccinated, so I can understand which of my people that has not been vaccinated. But unfortunately, I'm not as lucky to work with Google than work with WhatsApp. The last one that I would like to say is on this one, the telemedicine. When the peak of Delta, all the doctors doesn't want to see the patients. And all the doctors before in Indonesia is totally against telemedicine. Because in Indonesia, you give the license to doctors by region. So doctors is totally against telemedicine. But because of the doctor is scared to serve the patients, then we can work with 11 startups to do telemedicine. It started in July. It's okay, not that good, but when the Omicron hits on January, instead of 11, it becomes 17 startups. When you test positive, automatically you receive a WhatsApp, and you can go to the telemedicine, and the telemedicine doctor can give you a receipt, and you get a free molnupiravir or Paxlovid package for free, delivered also by the delivery startup. And the peak that we can do is 40,000 WhatsApp messages per day and 20,000 delivery of packets per day. So I'm very impressed. In the next 16 months, all the creativity in digital health appear suddenly. And I believe in the future, which I will share with you later on what the future will be. But I stop here to give the chance to others.
Minister, thank you. And that really is true. From challenge comes change. And I think what a great illustration of that. But then let me talk to you about data. You have a lot to say and really extensive experience in data, which we know is the lifeblood of a digital health system. What is Merck's strategy to break down data silos and to ensure data diversity and inclusion?
So before I answer the question, let me react perhaps to the telemedicine comment that the minister made, because I was fascinated by the story, first of all. And second, I understand that your physicians actually are kind of eventually reacting to or pushing back to that. And the question is, we have understood that very well during the pandemic, and keeping momentum on telemedicine is going to require a lot of passion from governments, as we have seen in the case of Indonesia, which I can tell you is not the case everywhere. So we can come back to this point before. But going back to data, we have, breaking silos is important, and it has to do quite a lot with the way your systems speak to each other. And of course, this is a continuous improvement process. It's not something that happens from one day to the other. And second, also have to do with our own digital transformation, right? That we started very early a few years ago, and I can tell you that this is a big cultural transformation for an organization, and so it is for humanity overall, right? So we have progressed our digital transformation to levels in which we have been able to create what we call data-driven business models, right? We have pilot, we have tested, we have failed, we have succeeded. Ultimately, what I'm proud of is having built a company within the company which is operating at what I call outside of the systems, right, and very much at arm's length from the corporation, that aims to democratize data and to by compiling data from different very prestigious cancer institutions in order to be able to offer that intelligence to cancer centers to improve patient outcomes. And well, this is one of the examples that we have at Merck, but at this time we are integrating data in our value chains. We are using data to improve, and artificial intelligence to improve our drug discovery or the productivity of our drug discovery. We are obviously trying to understand our customer expectations, by mining and processing a tremendous amount of data. But I see that the potential of this has to continue. Obviously, the pandemic has accelerated all the trends. You mentioned this. Are we where we need to be? Definitely not yet. And we feel that as a corporation, we need to contribute to generating additional trust, transparency, and most importantly, interoperability and collaboration to be able to ultimately provide better outcomes overall to citizens and patients in prevention and therapy.
Wonderful. Well, you spoke about drug discovery, so Baroness Shields, that's a perfect lead-in to your work. We know that the pandemic has really accelerated the use of artificial intelligence. What excites you most in this area, and tell us what you are doing in drug discovery and what gives you hope for the future.
I think what excites me most as a technologist, again, is that any one data point, any one biomedical data point or research insight could unlock the mystery of a novel discovery that could make an impact. So we started with that premise, and we built a multidimensional representation of human biology using all the world's biomedical information, ingesting all the literature, running natural language processing, machine learning across that, extracting insights that might be useful in the scientific discovery. And we built a suite of tools that enable scientists to scan across this omni-comprehensive biomedical graph and run actual in silico experiments in real time. So they're able to test out a hypothesis, and it's that hypothesis-driven approach that mirrors the way they discover drugs anyway. That's been that collaboration between science and tech that makes it very useful. And during the pandemic, we used this to discover new drugs, and we have over 20 in our pipeline already. Early stage, by the way, very early. But we used it during the pandemic in January of 2020 to look for any existing drugs that might be applicable to COVID-19. And on February 4th of 2020, so very, very early in the pandemic, we published a hypothesis that we had discovered that we looked at anti-inflammatories because, of course, the cytokine storm. We also looked at clathrin-mediated endocytosis as a process that we would want to inhibit that we were looking for drugs that could potentially inhibit, because that's how obviously the virus is absorbed in the cell. So we just did the weekend research project, and we discovered that a rheumatoid arthritis drug had the potential to inhibit that process. And we took a risk. We published it in the Lancet. They published it. And we published our evidence. And we contacted Eli Lilly, who owns the drug. It's called baricitinib for rheumatoid arthritis. And we got really like silence for about 6 weeks while they did their own in silico experiments, because they didn't know that the drug had this off-target effect. So that tells you the power of the insights that you can gather if you can reason across with AI and machine learning all of the biomedical information that's being generated. And you know, and what we learned is over time the FDA tested it with remdesivir, and then they tested it on its own, and there were large-scale clinical trials, 6 of them, and the hypothesis was proven to reduce mortality by 38% in hospitalized patients. Yeah. This is an unknown off-target effect. So for us, I'm really excited to see the potential of this. Now this is looking at a crisis situation with a small research team, but imagine that in the hands of research scientists everywhere. It's really powerful.
It's incredible. And is that your vision for how you see your company continuing to grow?
Yes, we want to see this technological capability in the hands of every scientist.
That's wonderful. We'll learn a little bit more in just a few moments. But Bernd, let's go to you. We've seen some impressive progress in digital twin, or combining the real and digital worlds. This represents a paradigm shift in how we understand individual diseases and improve the patient experience. What excites you most in this space, and what do you see as the biggest potential to improve health?
Yeah, so maybe let me start with the patient twin or digital twin as the vision for our company, so similar to your vision. Yeah? So the idea is basically that we refine the technologies which describe the patient so much, yeah, that we basically have a digital twin of the patient in front of us, and then based on that model, the diagnosis can be made, the therapy can be selected, the therapy can be simulated, can be planned, the response can be controlled. I mean, Bill and I had the discussion about the importance of imaging biomarkers and so on. And this is not a nerdy vision of a theoretical physicist or so, because I'm super convinced that every step we make towards that vision helps us to make healthcare better, more affordable, and also to the 2 ministers here, as they said, I mean, more accessible, better, because on that model, it gets better with every patient experience. Yeah? And I think this is, the model gets better, and what you learn in diagnosis. Every interaction of a patient with a physician generates knowledge, but in 99.9% in the world, it is currently lost. Yeah? So you can augment the knowledge. You can use the best physicians to look at the digital twin, so there is no physical travel necessary, no hunting for the second opinion, yeah, which is a big burden. It makes healthcare more affordable, because basically it allows you to use AI to take away the routine tasks of measuring the size of a tumor or whatever, so that physicians can work on the top of their license. Yeah? And staff shortage is the #1 topic I hear from our customers and partners in the developed world, and it makes healthcare much more accessible, yeah, in the low and middle income countries, because in the end you can take a digital first approach, yeah, for diagnosing and treatment planning and so on. And I think as a last comment, I think what we need to see is medicine, when it is at the beginning only compared to other industries, to get scaled, to really have scale advantages to make it better and more efficient. And here I'm super convinced that digitalization, AI, and digital twinning are key for making this progress. Yeah.
So that really, please go ahead.
And I think there is a dimension that perhaps has to be also highlighted, which is going to be also more sustainable, right? And when we aim to combine our sustainability objectives with improving healthcare. Digital technologies, no doubt, are taking us several steps further.
Definitely.
Yeah, I was just going to say that's personalized medicine to a T. Would you agree?
Yes, but I think what we need to know, I would call it the engine behind personalized medicine, yeah, because in the end, what is important is what is the knowledge behind and what is the delivery mechanism, yeah? How do you track what you see in this patient to the knowledge which has been generated by treating or diagnosing a million others, yeah? So, and it cannot be, yeah, with the explosion, the positive explosion in medical knowledge, it cannot depend on what's in the head of the individual physician, yeah? So I would call it the engine behind personalized medicine, yeah?
Perfect. That is wonderful. And speaking of millions of people who have disease, of course, all of us who think about health and well-being are very focused on the Sustainable Development Goal 3.4, where we seek to reduce premature mortality from non-communicable diseases by 1/3 through prevention, treatment, and promoting mental health and well-being. So Minister Budi, back to you. Talk a little about your vision for your country and how digital health will help you achieve this SDG goal.
I just learned about genome sequence and biotechnology about 6 months ago, because at that time we only do like 140 sequence in 9 months to identify whether we have the variant. I don't even understand what is the variant alpha, beta, delta, and gamma. I need to learn, or you can only do it with genome sequencing. What is genome sequencing? How many we do genome sequencing? For your information, when I joined, in 9 months, we did 140. And then I learned in 3 months that I need to do more. So I work with the Ministry of Education, expand, link the network to 12 labs that do 2,000. And then last July, I got a grant from a global fund, which is my friend, who is also a CEO of Standard Chartered, become health professionals. And now I have 40 Illumina, Oxford Nanopore, BGI machines with 7,000 or 8,000 genome sequence capability. First, I realized that genome sequence can only do surveillance to do 30,000 sequence of the virus. Then I realized, oh, you can do also tuberculosis. We have a lot in Indonesia, 4.4 million. And then I realized they can do also human genome sequence, which is 3 billion. And before, when it started, the price is $1 per base, so 3 billion US. Now I can get it less than 500 US per human genome. And then I realized that, hey, oh, this is the future of medicine. This is the future of medicine. I'm a physicist. In early 1900, the smallest component is called an atom. It's founded. And it led to a technology revolutions where nuclear energy is there, nuclear bomb is there, laser technology, space station. It comes because scientists found the smallest component of physical things. In the middle of 90s, again, scientists found the smallest component of informations. It's called bits. And then, you know, Google comes, computer comes, semiconductor comes, everything comes from this basic scientific invention. And I strongly believe when people found that the smallest component of living things is DNA, then I strongly believe in the future, mRNA technology, monoclonal antibodies, you know, whatever, stem cell therapy, gene therapy will flourish. So then our role is to make sure that we establish a platform. So now I'm implementing this electronic medical record that I will issue the regulation in July for all existing medical record in laboratory, in hospitals, and also in private clinics. They are given 1 year to adapt to the standard 5-year standard owned by the government. And then this medical record will be linked to the genome sequence data record that we will start, you know, the sequencing on this July also, because the machines are coming on May. And instead of giving it also to the scientists only, I give it to the hospitals. So the translationals between only research to produce journal, instead to produce research to cure cancer, to cure stroke, or, you know, diabetes, happens quicker. And we already established a regulatory sandbox, and we tried this a month ago to invite all the startup companies to use our platform so they can do research. Because I have, like example, tuberculosis, thanks to my Indian friend. We did like 1 million X-ray tests, and we use Cure AI, if I'm not mistaken. There is an Indian artificial intelligence company to detect whether you have a tuberculosis or not. I just bought an ultrasound, 10,000, to deploy to our primary care, because now the ultrasound have the capability also to do AI. So I can do AI to 4.8 million babies every year that we deliver. And these all data will be centralized in the government, and we can use this for research and also for startup companies if they want to advance in science. And we'll link this metadata to the genome sequence data, and I believe that will, in the future, it will improve the human being. And I believe that somebody told me lofty mountains, only the great earthquakes bring the lofty mountains. Yeah. So I believe we have a great pandemic, but it opened a lot of opportunity for us into digital revolutions and have a better health for our next generation.
Absolutely. You have done more in 12 to 16 months than many countries have done in much longer, so congratulations. Well, and let me go to you. Merck is well known for its partnerships, and I know that you are a big proponent of partnerships. Can you give us an example of one that excites you, that is really going to help accelerate digital use?
I mean, it's impossible to harness the power of data and digital without collaboration and partnership. So the syntropy I mentioned during my first answer has been the fruit of the collaboration with Palantir, which has offered their data expertise to combine with our healthcare and healthcare professional expertise and capabilities to create a product, right, that, as I mentioned before, we are hoping will significantly help advance new therapies for cancer. But partnering is hard, right? I mean, it requires aligned goals. It requires complementary capabilities, that wasn't obvious to our organization, right? I mean, when we have collaborated with some other companies, of course, organizations have a tendency and a culture to be a bit endogamic and to do their own way. So sponsoring and championing from the top is important, so that we learn how to collaborate, align goals, complementary capabilities. And the critical thing is that we have the same understanding of the mission that we are going to do together, right? That we share the purpose of improving patient outcomes, of advancing human progress, right? And there we have made fantastic experiences, created an advanced personalized medicine by collaborating with companies like Joanna's, building artificial intelligence integrated ecosystems, and most importantly, complementing our important efforts around data, our own internal data, with very fruitful collaborations to at the end, improve outcomes. But it's hard work.
It is hard work, but a big payoff at the end, that's for sure.
And a big return.
Yes.
At the end, and we learn as we go, because when purpose is shared, right, then the outcomes is always good.
Yeah. So Jana, let me come to you. Obviously, we know the quality of data going in to something speaks to the quality of data going out. Absolutely. Tell us about diversity in data and your point of view on that, and what can we do to do a better job of having more diverse data?
Well, I think diversity, relating to ethnicity is very important. I'll come to that second. Okay. But the most important thing is, in terms of enabling discoveries, is to normalize across all these disparate types of data sets. So it's a complex science, but if you can mine all the information that's in all the world's scientific literature, and you can generate with machine learning new proprietary insights that are not known, because the human brain cannot possibly fathom all of those connections. And you can store those in a system, a learning system that then can be recalled when combined with an AlphaFold database to design the right molecule, or combined with precision medicine, biomarker information, genomic sequencing. All these data sets are disparate and different, and ways to normalize across them is absolutely essential, so that you can get the diversity of the data that's available out there and empower scientists to make these decisions. I know that there are many countries that are here, and I'm excited to hear this, that are starting to sequence data for their populations, and many, many more are coming online. I know there's a big one, a Future Health one, coming online in the UK, and we had Genomics England as well. So we've been in the forefront in the United Kingdom, but it's absolutely essential that you get the other ethnicities in the data sets, and we've seen that already, because London's a very diverse city. Yes. So just in that single data set, we've enriched our predictions substantially. So it is proven. And the other thing I wanted to mention is, as a technologist, I humbly say that I understand the importance of evidence and how important that is when you're thinking about human life. And there's no substitute for the actual wet lab experiments that validate these hypotheses, and we have our own wet labs. But the thing I wanted to mention is that if you can give scientists access to all this information, enable them to make higher quality predictions that are novel, that they have a super high confidence they're going to get a good result in the lab, and consider the multitude of factors around target progressibility, and whether you're going to be ligandability, whether you're going to be able to actually drug that target, what are the toxicity problems that you could encounter. Incorporating all of that information, which is in the world, it's in the open domain, into your analysis at the outset, increases that probability of success that you're going to have a drug down the line that is novel, that does what it says it's going to do. So that's a really exciting thing.
Yeah, very exciting. And, Bern, let me come to you, because when we hear this amazing work that both you and Joanna are doing, and I think about the word trust. So at the end of the day, if a patient and their physician will use a digital twin to help make sure they're getting the best diagnosis and treatment, what do we do about trust?
I think there are three super important topics on the journey.
Yeah.
One is that we really look at it from an opportunity mindset. The second is that we are ready to change the system for the technology and not the technology in order to fit the system, and then basically zero tolerance when it comes to breaching trust. When I say opportunity mindset, when you ask a patient, would you like to benefit from the experience we have made with 1 million other patients? Everybody would say yes. Mm-hmm. Would you like to share your data? People say no. Yeah?
That's right.
But this is what I mean with opportunity mindset. Yeah. If you had the choice, I go to a physician who always forgets what he has done and will never tell what he or she has seen, or would you like to go to a physician who has a lot of experience? Yeah? This is opportunity mindset. Yeah? And I think this is very, very important in the discussion, that we look at this and not only at the risk. Yeah? And I want to say we are responsible not only for what we do, but also for what we not do in using such a technology. I think that is really important in the public debate also. Then it's about changing the system for the new technological opportunities instead of the other way around. I mean, you said legislation in Indonesia, you cannot operate in different states or whatever. We see this in teleradiology and other areas, or people say, well, this technology is stealing my job. Yeah, we have to change the job profile so that people say this is elevating what we can do, and so on, instead of trying to make it fit for a system which has been created where these opportunities haven't been really there. Yeah, I think this is really important. And third, it's really, when it comes to trust, zero tolerance. Yeah, when it comes to data privacy, but also when it comes to mistakes. I mean, we know this from self-driving cars. Any mistake goes through the press, yeah? And any data privacy problem also is public, yeah? So we need to be extremely obsessed, yeah, by having this in the DNA of developing things, yeah?
Can I build on that?
Of course.
I am passionate about dealing with the challenge of trust, you know, and in this context, and I believe this is a big challenge that, if not managed, may hinder the progress, right? So at the end, I mean, Bernd, I believe was very clear on the topics, but I think there is an effort that we have to add from the industry, right, and from the different stakeholders on building a code of ethics that will, in a way, help us have operate under a moral compass, right, that will establish and will give confidence and more transparency to patients that need to offer their own data. So we have been the first company to publish a code of digital ethics, and we are sharing with other companies, because this is definitely offering to patients or citizens, right, the opportunity to understand the rules of the game, right, and what is it for them.
That's very important. Let's turn now to the audience. Do we have any questions for our panelists from the audience? Yes, please, if you could stand and state your name. And
my name is Alistair Grenfell.
Here's a microphone for you.
Sorry. My name is Alistair Grenfell. I work at IQVIA, which was formed with the merger of IMS Health and Quintiles, and I thought the discussion was great. The one comment I would say, having a somewhat panoramic view of the industry, is Belen's point about culture. We shouldn't underestimate that. If we're honest with ourselves, clinical trials haven't changed or evolved in 25 years. And pre-pandemic, we were still doing clinical trials in 2019 like we were really in the late 60s. And I love Joanna's examples of drug development. But if you look at how the industry still creates protocol design, how it site selects, it's still based on historical norms. And it's so hard to industrialize data and analytics when you have people who've been in their roles for such a long time. And I think the answer, because I was told earlier at Davos, you ask questions, not answers. I think the answer perhaps is we have to do even more amplification of what good looks like. I thought your Lilly example was absolutely brilliant, because I think we've got a storm coming from a macroeconomic perspective. I think it's going to hit the intersect of probably the biggest innovation that we've ever seen. I think we have a duty to deliver that innovation to patients. And I think if we can compress those trial timelines, as well as bring medicines to patients more quickly, it's what we're here to do. But it doesn't matter how we get the data, how we analyze the data. If you don't change those industrialized processes and break the blurb, I think we have a huge problem. So it's a statement, not a question. But I think it's great today, but we shouldn't underestimate that culture question.
Thank you so much. Really wise comments. Joanna, did you want to respond to that? You were shaking your head and smiling as he was speaking.
Yeah, I mean, we're doing our first clinical trial right now. So I'm living and breathing that. It's definitely challenging.
That's great. Thank you.
I fully agree as well. I mean, we have, not only because of acceleration and also sustainability, but also because of the diversity component that we were speaking about. So fully agree with your comments.
Thank you. Any other questions? Yes, in the back. If you could stand, please. We have a microphone for you. And
Hi, my name is Sue Valerian. I'm a nurse practitioner, and I was just wondering about repurposing drugs that you were talking about, the hypothesis behind looking at all this data. Do you go out to look at for diverse populations? And you were talking about some data is not shared readily by folks. Would you go out to diverse populations, indigenous people, different Latina continents, Africa, to ask clinics for their data so you could put it into, say, your AI, your computers, and find out which drugs could be repurposed for different
Joanna, maybe a very quick response because
Yes,
we're getting tight on
absolutely.
time.
We don't set out normally to repurpose. This was just a one-off given the situation with COVID. But in general, when we get to the stage where we've refined a hypothesis, we look for the right data partners to augment that, because when you're going into the experimental test phases, you benefit greatly from having key opinion leaders and research partners that can tap into diverse data sets that and bring
Yes.
human tissue samples and everything.
And everything else that helps it come to life. Well,
Everything.
what I would take away from this wonderful discussion is that the future of the world is very bright. We have amazing leaders of countries and amazing leaders of companies really delivering on the promise of bringing digital to improve the health and well-being of people everywhere. Thank you for being with us today, and thank you to all of you for joining.
Thank you.